Welcome back. Recently, data from the Association of American Medical Colleges reveals just 5.7% of U.S. doctors are Black, a figure that has only marginally improved over the past 120 years. This persistent underrepresentation underscores the urgency of diversifying the healthcare workforce. Unfortunately, obstacles for students of color arise as early as elementary school, where limited exposure to and participation in science can erode interest in pursuing a medical career. Joining us to tell their point of view on the matter is Chief Executive Officer of the Arthur Ashe Institute for Urban Health, Dr. Marilyn Fraser. Doctor, thank you so much for joining me.
You're welcome. It's wonderful being here with you.
And I
Thank
just want to
you.
make sure, is Ash, is that the correct pronunciation?
Yes, it's Arthur Ashe Institute. It was founded by Arthur Ashe just before he passed away.
Okay, thank you so much for clarifying that. I wanted to make sure I was saying it right. Now, can you elaborate on the historical exclusion of Black individuals from the medical field and how it has contributed to basically what we're seeing now with the underrepresentation of Black doctors in the United States?
So it's interesting. I listened to a talk about a couple weeks ago, and they were just talking about historically how blacks were excluded from the healthcare workforce, and that was intentional in terms of even having medical schools where blacks can go. We started out years ago having 14 medical schools that were focused on admitting black applicants, and that went down from 14 to five and then to two. And right now we have four medical schools that are focused on that. But historically, blacks have been disenfranchised and has been removed from the healthcare workforce, either by not having medical schools where they can go, or even when they're going to medical schools, things were so difficult and there were a lot of roadblocks that have been put in place. Unfortunately, we have not come much closer to where we were years ago. We still have, as you mentioned, just 5.7% of Black doctors. And when we look at Black males, we even have less. And we need to do more about that to make sure that we're intentional about recruiting Blacks. We are training them, making sure that they have training post their medical education so that they can specialize and be well equipped to perform as doctors.
Now, what are the potential consequences of this underrepresentation, particularly in addressing health disparities in communities of color?
So one of the potential impacts of not having enough people of color in the health professions is a reduction in quality care. We know that people like to go to doctors that look like them, like to have health professionals that look like them, and they do better in those settings. Studies have shown that if you are a Black person and you go to a Black doctor, that your health outcomes are better than if you went to a doctor that was not. Just because of culture, just because of people relating to people that may understand them better, it's important that we diversify the healthcare workforce.
And I also want to add to that, I could imagine that being super important just because I know for a lot of people, like going to the doctor and they tell you, you have to eat these certain foods, but like if nobody in your family eats those foods, I could imagine that's really challenging.
Exactly, exactly. When you go to the doctor and they tell you that, okay, you need to have your plate should look a certain way, and we look at the food plate that we see that's naturally shown, and for some people, they don't relate to those things. I mean, for Caribbean people, for instance, they may not have the rice and the steak and the vegetables that way. They may have some ground provisions, root vegetables, or they may have salt fish instead of fish. You know, those different kinds of things are important. And also it's important that they're role models that look like you. If you aspire to be a doctor, it's wonderful to know that there are doctors that have gone that path before, and that you can follow in that path. So it's not, it's more than just a health piece. It's also about having role models and having people know, and children, young people know that they can attain certain things. because there are people that have gone that path before, and those people look like them.
Now, speaking of children, how do early educational disparities and limited access to science education resources affect the interest and preparedness of students from racially and ethnically diverse backgrounds to pursue careers in STEM or medicine?
So, in preparing students for STEM or medicine, it's important early on that we are exposed to those things, that we're exposed to the sciences, we're exposed to anatomy or physiology, and we're exposed to those things that may pique our interest in the health professions. And if we are in schools that may be under resourced, that may not have those equipment, may not have simulations, may not have the technology or any of the resources that are needed to help our students pique their interest, so to speak, it's hard because they're starting way behind their counterparts that may have better resources, that may be in well-resourced schools, that may be in communities where you have those opportunities that our students may not otherwise have. So it's important that those schools are resourced and that policies are in place to make sure that our students are prepared, and our students are starting on somewhat of an equal or equitable footing, so to speak.
Now, I also want to talk about the exposure. You kind of talked about it a little bit, but why is that important? And then also, there are a lot of Black students and students of color who are interested in these fields, but feel intimidated sometimes, or sometimes they can't keep up. I know I had a friend who, when she was in college, she had to do a lot of tutoring just to kind of like match her peers who were already learning what she's learning now in middle school and high school. So can you talk about that challenge for the students who do have that interest?
Yeah, I think the challenge is the exposure for us to make sure that the students that have the interest are equipped to perform well. I think our students are not less educated, they're not less intelligent than others, but making sure that they are aware of the things that are out there and opportunities for them to pursue that, and make more opportunities available, because right now we have some, but I think we can do so much better within our schools. And as you mentioned, there are students that may not even know how to study. Right. One of the things that our Health Science Academy has done, in addition to giving students some science education and making sure that they learn about anatomy and physiology, there are those soft skills in terms of how best do I study, what environments are better for me in terms of studying, what are my study skills and what are my study styles, and so on, so that those things help a student to be prepared and help them to be successful when they go through school as well. When we talk about a historical reference, a reference that was brought up to me was about when schools started to be integrated, when medical schools started being integrated, and to kind of fulfill a quota, some schools would admit one student of color. And another school would say, okay, you know what, I'll admit another student so that they can have a study buddy, or they can have somebody else they can talk to, because in those systems where that post segregation, in those the initial systems, people were isolated, and so you cannot do as well when you're isolated, when you feel as though you're the only one working to achieve a goal, and you do not have that peer support, you do not have mentoring. And oftentimes, even now, our students feel isolated because they may be the only ones that may be interested in a certain profession, but they do not have the folks with them to help them to navigate that along the way. So mentoring is also important, and having folks that are like you, that are like-minded, that you can work together.
Now, I'm really glad that you brought that up because that wasn't something that I ever thought about. I'm curious to know now, we talked about how, there aren't many Black physicians. Do you feel isolated even now? Like, you've done the work, but now practicing is, does that isolation stay with you, considering that we don't have that many Black doctors and well, I will stick with Black doctors for now. Do you feel that sense of isolation still?
I think that there is a, for me, I don't, because I'm in a community setting and I'm in a setting where like I have like-minded folks around. I have faculty members that I could communicate with and so on, and I'm not practicing. But I've had folks that I know and other physicians that feel isolated because when they're going into residency, they may be the only Black or the person of color there, and sometimes it's the racism that you feel, it's still there, and so those things cause people to feel isolated when they're going through their postgraduate work, especially when they're doing residency or they're doing a fellowship. Sometimes the discrimination is so much that people do feel isolated, even though they're past that trajectory of high school and college or medical school and so on.
Well, thank you so much for sharing that because that definitely just came to me. And we don't talk about like how that affects, the physician, like sometimes you have to advocate maybe a little bit more for patients because of this background knowledge. That was something that like having this conversation made me think about. So thank you so much for sharing that.
You're welcome.
Now, we talked about it like on an individual level, but could you discuss the public health implications of the shortage of Black physicians and the disparities in healthcare outcomes for patients of color, more like on a community level?
Yeah, so on a community level, the same issues exist where if you do not have physicians of color, you do not have people that patients may listen to as much in terms of their care, and feel as though their physicians and healthcare providers are working with them to better their care, then you have what we see with a lot of people not having access to care, not a lot of people not accessing medical care even if it's available, because sometimes they just cannot relate to their doctors. And something that's important also to state is it's not just because a doctor is a person of color that they will be relatable to a patient of color, because there are all other issues that play into that too, whether it's culture, whether it's class, whether it's some sexism, gender issues. Those things are in there as well and make it even more complicated. But on a public health basis, it's important that we have more physicians of color, that the entire healthcare workforce is diversified. So different views, different cultures can come in to make it richer, make it more effective in terms of treating patients across the board.
Now, you touched on it just a little bit earlier before, but can you discuss the role of educational initiatives like the Health Science Academy in not only increasing representation, but also promoting diversity at all levels of healthcare in the workforce?
Oh yeah, so when our students, or generally our health science academy is divided into different portions. So we have a middle school component where we go into the schools, and the sixth graders, they have general health sciences. The seventh graders get sports medicine. The eighth graders get forensic sciences. And then we have a ninth grade bridge program that exposes students to the 3 year after school program that we have, which is our academy. And that program goes from 10th through 12th grades. And so those students come to SUNY Downstate Health Sciences University. They get exposed to anatomy, physiology, and some of the soft skills that I mentioned. And so they are equipped and they're prepared for the health sciences. When they come into Downstate, when they come to us at the Institute, they think of health careers as nursing and medicine, and those are the only two they think about. But when they come to us, they get exposed to the other schools that are downstate. So they get exposed to the School of Public Health. They get exposed to allied health or physical therapy, occupational therapy. They get exposed to graduate studies so that if they want to do research, they know that that's a path as well. So it exposes them to a diverse array of professions within health, as opposed to just medicine and nursing. So it's a wonderful tool and a wonderful opportunity for our students to be able to participate in the academy, get exposed to those different careers, but also be equipped understanding health disparities exist, understanding health inequities, and how they can advocate for themselves, because oftentimes students are not able to do that.
And what are some strategies the organization uses to help motivate these students? And can you talk a little bit about the mentorship aspect of it?
Oh yes, definitely. So one of the strategies to motivate our students. Our students come with an interest already in health. So when they see simulations, for instance, that's something else that's different that they wouldn't get in their schools. Our students partner with community-based organizations to do research. They present their research findings in a poster that would look uh, better probably than an undergraduate poster oftentimes, and they present those findings in poster sessions. They start thinking about policy and policy implications of the for the work that they will do. And so they get to what they get in the academy really helps them to be prepared. Also, with the academy, they're often taught by students, medical students, or students from the other schools. So these students are not very far removed from them, and they serve as mentors, and they serve as folks that they can look up to, and to aspire to do those same things one day. So the mentoring is something that's continuous. They get mentored by the people that work with them. They come back to us. We follow them up when they go into college, and we have an alumni coordinator that follows our students. So they get a lot of mentoring that we are really happy that they have that opportunity to do.
Well, Doctor, I want to thank you so much for joining us and have this really important conversation.
Thank you so much. Thank you so much. I just encourage everyone to visit the Institute's website at www.arthurasheinstitute.org. Our annual fundraiser is coming up in a couple of almost a month. And so we encourage people to just visit our website. And if you need to donate to the Institute, you can do that there as well. So thank you so much.
Of course.